The Health System Strengthening Program is an initiative by the Ministry of Health and Wellness aimed at transforming healthcare for a better future. This program, funded by the Government of Jamaica, the European Union, and the Inter-American Development Bank, is focused on creating a more efficient and patient-centered healthcare system. One of the key features of this program is the upgrade of 13 health facilities across Jamaica and the installation of state-of-the-art medical equipment that will improve service delivery to our patients. Today, we have the opportunity to sit with Mr. Karl Chin, our construction engineer. He'll be telling us more about the work being done in this area and the impact that it will have on Jamaica's healthcare system. Hi, Karl. Thank you so much for taking the time to sit with us today. Can you tell us a little bit more about the planned work that you have for the upgrade of the medical facilities and equipment across Jamaica?
Well, thanks for having me. So through the HSSP, we'll be undertaking the expansion and renovations of 13 health facilities across 3 regions and 3 parishes. Specifically, we'll be doing work at 3 hospitals and 10 health centers. So for the hospitals, we'll be expanding or constructing a new building to expand services at the Spanish Town Hospital, the Maypen Hospital, and the St. Anne's Bay Regional Hospital. With respect to the health centers, we'll be constructing greenfield projects. So we'll be doing new health facilities for Ocho Rios, Maypen East, and the Old Harbour Health Center. And we've constructed a temporary building for Brownstown Health Center. We'll be demolishing the existing and constructing a brand new facility at Brownstown. And we have 6 other sites that will be expanding the services, which includes the Maypen West Health Center, Moko, Chapeltown Community Health Hospital, St. Jacob Park, Greater Portmore, and St. Anne's Bay Health Center.
The work that you're doing, it sounds amazing. But what will this mean in practical terms now for our staff, our stakeholders, and our patients?
So in practical terms, the renovations of these health facilities will allow for improved healthcare service delivery. We'll be expanding on the physical infrastructure of the hospitals and the health centers. We'll be providing new services including oncology, gastroenterology, neurosurgery at the various hospitals and health centers. All of these, in addition to the installation of new equipment, modern medical equipment, will allow for better delivery of healthcare and reduce wait time. The main aim of all of this is to reduce the country's exposure or risk to non-communicable diseases, which is the main focus of the HSSP program.
With all of these exciting benefits that you've just shared with us, my natural question is, when can we start, experiencing these upgraded facilities and accessing these new services?
Well, we've actually started through our collaborative approach with the regional health authorities. We've already completed Chapeltown Community Hospital. And for the other facilities, we plan to roll out over the next 2 to 3 years, hopefully ending in 2028. By that time, we'll be able to realize the completion of the facilities, equip them with the medical equipment, and be able to realize reduced wait times, improved health services, and a better working environment.
That's really good to hear, Karl. But with construction, sometimes there's noise, there's dust, traffic, all these things that cause inconvenience. What are the plans that you've been putting in place or that you can, comfort our listeners as we await the rollout of these additional facilities?
So, with construction, there is an expected amount of disturbances. However, we have a social specialist and we have an environmental health and safety specialist that we work with in order to put the necessary plans in place to mitigate against these issues becoming real challenges. So we have something called an environmental health and safety management plan that sets out how to deal with all of these particular activities when they occur. So we'll be putting in place things to mitigate dust nuisances, dust screens, water misters. In terms of noise, we'll be working in the off-peak hours when necessary. In terms of traffic disturbances, we'll be doing concrete pours at night to sort of reduce the impact on the community. We also have a very extensive communication plan in place where we discuss our intentions with both the staff and community members so that they understand what is going to be happening at the various stages of construction. So to keep community members and patients and doctors in the know, and just to ensure that everyone understands what to do when things happen. So we also have a grievance mechanism in place. They can report it and the matters are addressed accordingly.
Well, thanks, Karl, for keeping us in the know today. But if there is need for more information, where can people go to find additional information about the work that you and your team are doing and the HSSP program in general?
Well, it's been my pleasure so far. If anyone wants more information, they can visit hssp.moh.gov.jm.